Deep in our world of modern civilization runs a disease that is threatening to become the number one killer in any economy. It runs in families, though there are no simple patterns of inheritance. Obesity and other environmental factors of today's modern-day living have been known to be causes for the disease as well. And once you acquire the disease, it will be with you for life. But how many of us know anything about this mysterious killer disease within us? This documentary program hopes to explore with you the various characteristics of this killer disease. How to avoid it, or if you've already acquired it, how to control it and live a normal life.
So what is this killer disease, diabetes, and how does it occur? To understand this, let's look at what happens in a normal person. In a normal person, the food that is eaten is digested in the stomach and absorbed into the blood normally. The pancreas produces enough insulin, and the insulin helps to move the sugar from the blood vessel into the body cells, where the sugar is changed into energy and used. There is enough insulin, the sugar is properly used, and the blood sugar remains normal. Now let's look at what happens in diabetes. In diabetes, the food is digested and absorbed normally. But the problem happens in the pancreas, where the amount of insulin produced is not enough, or it does not work properly. So the amount of sugar in the blood builds up, spills into the urine, and is wasted. So in diabetes, there is little insulin, sugar is not properly used, builds up in the blood, and is wasted in the urine.
There are two common types of diabetes which differ in their course, onset, and treatment. Insulin-dependent or type 1 diabetes mainly occur in children or young adults who may be normal or underweight. The pancreas produces very little or no insulin. The symptoms usually occur over a short period of time. They may develop diabetes coma easily. People with type 1 diabetes need insulin injections to stay alive. Non-insulin dependent or type 2 diabetes affects many adults over the age of 40 years and more common in people who are overweight or very fat. The pancreas may produce slightly less insulin, or the insulin produced does not work properly. Most of the people with type 2 diabetes can control blood sugar through diet, exercise, and tablets. Many adults with diabetes do not experience the symptoms, which means that it often goes unrecognized until too late. And here lies the killer sting in this disease. In any case, a person suffering from diabetes may lose consciousness if the level of sugar or glucose in the blood is too high. This condition is known as diabetic coma. Diabetes is a major public health concern in Fiji and developing island nations of the South Pacific region. Many of these people with diabetes need medication to control their diabetes. Thus, to help control blood sugar levels and prevent more people from developing complications, everyone needs to know about it. Effectively controlling diabetes means keeping blood sugar levels normal. Now let's look at some of the common symptoms of diabetes. Passing a lot of urine, feeling thirsty all the time, having blurred vision, losing weight, tiredness, skin infections which take long to heal. We must remember that many people with type 2 diabetes do not have any symptoms, even though their blood sugar levels are above normal. The risk of diabetes can be inherited. In fact, if your parents or close relatives have diabetes, then you have a greater risk of developing the disease. And more importantly, the risk we acquire from our daily lifestyles. Common lifestyle factors which increase the risk of type 2 diabetes are being fat and overweight, not exercise regularly, improper diet or eating too much foods, physical stress such as broken bones or serious infection, mental stress like worries and work pressures, and taking too much alcohol. All of which amounts to the kind of lifestyles we now lead. Now that we've examined the high-risk factors and symptoms of the disease, the question naturally is, how can we control this disease? As mentioned earlier, once you've acquired the disease, it will be with you for life. There is definitely no cure for the disease, but one can control it if managed properly. First and foremost is your diet. You need to have a healthy diet every day. Exercise regularly in order to keep your body functions at peak levels at all times. Take medication as advised by your doctor. Monitoring control such as urine testing, blood sugar testing, regular checks with your doctor. Control body weight. Try to learn more about the disease.
This mysterious killer disease should not be taken lightly. If you have diabetes, you can still lead a healthy and happy life if you learn to control it.
And to control diabetes effectively, you need to follow the advice we've given in this documentary or consult your nearest health center or hospital.